my name is Sheila. I'm a paramedic, and we're here today to discuss blunt and penetrating chest injuries. These can be very serious. They can be dramatic, which I mean basically blood squirting, open chest wounds, or they can be not so obvious and the patient is intact, just complaining of chest pain or soreness or something like that. So since they can be life-threatening quickly, we need to maintain a high level of suspicion when it comes to the chest. The reason why: the chest cavity is full of all kinds of major critical organs. Everybody should have these 4 handouts. So the lungs, the heart, the aortic arch, the diaphragm, all of that, if it gets bruised up, penetrated, could cause some problems. One example, the pneumothorax. Let's say you have a stab wound to the chest. You do not want to remove a knife if it's still in there, but you do maybe want to seal around it so air doesn't leak in. Listen to the lung sounds, but there's a pleural lining across the chest. If that gets penetrated, blood can fill up in there and it crushes down on the lungs, and the patient can't breathe well and they can become shocky quickly. Next one, the pericardial tamponade. You don't see it very often, but basically a bruise to the heart. The sac around there fills up with blood. It compresses the heart. And again, that can be a life-threatening, and on the ambulance, there's nothing that we can do about that. In the pneumothorax, if you're a paramedic, you can pleural decompress the chest, and hopefully that will be good enough to get them to the hospital. So our job is to recognize these injuries and manage them the best we can. So we'd also like to do a rapid assessment on the scene. And this involves basically, so I have a pediatric patient here. Don't have the lower half, but we're going to do the best we can. So you do a 2-minute super quick check. Listen to the lung sounds, make sure they're moving air. Look for the neck, make sure there's no obvious. So what you're looking at is for the life threats. You're looking for tracheal deviation, arterial bleeds, again, any penetrating massive injuries to the abdomen. If you find any of these, if you find the tracheal deviation and decreased lung sounds, you want to go ahead and decompress the chest with a needle if you're a paramedic. The other stuff, you find a major hemorrhage. If it's not, you can't do it on the chest, but on the arms, apply a tourniquet. Again, flail chest, you'll see a segment of the chest coming in and going out. You can put a pillow over that, splint it, and preferably it helps them breathe better. Then you go on down the body. This is all done in less than 2 minutes. If you're having spinal restrictions, I don't have enough people here, but somebody would hold their head, you'd log roll them, and you'd look at their back. Any way you do it on the primary survey, you do want to look at their back, because it does, you might miss an injury on their back, gunshot, bruise, bleed, stabbing, anything. If somebody has clothes on and you can't visualize their back, the clothes can soak up a lot of blood, they can cover up injuries. So you do need to remove clothes, and you need to check very well for injuries. All this is pretty much done in 2 minutes, and in that time you're considering how you want to transport them. They need to go to a trauma center, or if you need to call a helicopter. Again, sometimes calling a helicopter is how you get dispatched out. The number of patients that you have throws in a criteria. Are they entrapped? Are they not? You have to be careful whether the scene's safe. Car accidents, fuel, oil, who knows what, chemical spills, gunshot stabbings, is the person around that has done that. Do you need to stand back and let the cops secure the scene? So all that is done pretty much either en route to the call or on arrival, and after you take a quick glance at the patient, then again, you want to pretty much do a quick transport, especially if they meet the trauma criteria. You basically load them and go. You do the rapid assessment and you load them and go. We can't always get done with the secondary assessment or an ongoing assessment. If you turn them over to the helicopter crew, you might get to the hospital before you get done. You take time to cut the clothes off. Looking for injuries on the way into the hospital. You start putting a monitor on. You're starting hopefully 2 large bore IVs if you're a paramedic crew or a crew that can do that. After the secondary survey where you find whatever injuries you might not have taken care of on the primary, you do a more thorough assessment on the secondary, take more time doing it. And then after that, the rest of the way in, you continue doing an ongoing survey, checking their blood pressure, checking their pulse ox, anything that you've done. If you've decompressed the chest, you re-listen to lung sounds. You make sure that the IVs are still intact. Checking the patient's blood pressure. Do they need more fluid? Can you cut the fluid back? Watching the monitor, see if you have any changes on that. Talking to your patient to see if anything else is developed. So these are pretty important injuries and they need to be treated seriously. Are there any questions? Okay, not hearing any questions. There's a lot more, and I would suggest that you read about it, research it, because chest injuries are very important and can be very critical. So time is a factor. Thank you for your time.